The Opioid Crisis Explained: How America's Deadliest Drug Epidemic Was Built. In 1995, a pharmaceutical company launched a prescription painkiller called OxyContin. They told doctors it was safe, effective, and carried minimal risk of addiction. Within a decade, hundreds of thousands of Americans were addicted. Within 2 decades, more than 500,000 Americans were dead. Welcome to Medical Sciences Unfolded. This is the story of the opioid crisis, how it started, why it spread, and what the science behind addiction tells us about the path forward. To understand the crisis, you first need to understand opioids. These are drugs that bind to opioid receptors in the brain and nervous system, the mu, delta, and kappa receptors. When they bind, they do 3 things simultaneously. They relieve pain by blocking nociceptive signals in the spinal cord and brain. They induce euphoria by flooding the nucleus accumbens, the brain's reward center, with dopamine. And they suppress respiration by acting on the brainstem, which is the mechanism of overdose death. Natural opioids include morphine and codeine, derived from the opium poppy. Semi-synthetic opioids include oxycodone, hydrocodone, and heroin. Fully synthetic opioids include fentanyl and methadone. Fentanyl is 100 times more potent than morphine. The crisis unfolded in 3 waves. The first wave began in the 1990s when Purdue Pharma, backed by the Sackler family, launched OxyContin, an extended-release oxycodone, with an aggressive marketing campaign targeting primary care physicians. Sales representatives falsely assured doctors that extended-release formulations were less addictive. The company sponsored misleading research and funded pain management advocacy groups. Prescriptions skyrocketed. Between 1991 and 2011, opioid prescriptions in the United States tripled, from 76 million to 219 million per year. Patients who became addicted faced a problem. As tolerance developed, they needed higher doses. When prescriptions were cut off or became too expensive, many turned to heroin, which was cheaper and more accessible. This was the second wave, a heroin epidemic that swept rural and suburban America in the early 2010s.
The third wave arrived around 2013 and proved the most deadly. Illicit fentanyl, synthesized in clandestine labs, primarily in China and Mexico, began flooding the drug supply. It was mixed into heroin, pressed into counterfeit pills, and later laced into cocaine and methamphetamine. Because fentanyl is 100 times more potent than morphine, even a dose the size of a few grains of salt can kill. A person who thinks they are taking one drug is unknowingly taking fentanyl. This is why overdose deaths accelerated. In 2021 alone, over 80,000 Americans died from opioid overdoses, more than were killed in the entire Vietnam War. The neuroscience of opioid addiction helps explain why it is so hard to escape. With repeated use, the brain's own opioid system, the endorphin system, downregulates. The receptors become less sensitive. The brain produces less natural dopamine in response to normal pleasures. The person no longer feels joy from food, relationships, or achievement. They feel withdrawal, a deeply unpleasant state of anxiety, pain, sweating, and craving. Continuing to use opioids is no longer about getting high. It is about avoiding withdrawal. This is why medication-assisted treatment works. Methadone is a long-acting full opioid agonist that prevents withdrawal without producing a high when taken orally at prescribed doses. Buprenorphine, sold as Suboxone, is a partial opioid agonist with a ceiling effect, making it safer and harder to overdose on. Naltrexone is a complete opioid antagonist that blocks all opioid effects. These medications cut overdose deaths by 50 to 70% in patients who take them. Yet access remains limited by stigma, regulation, and inadequate healthcare infrastructure. Naloxone, brand name Narcan, is the reversal agent. It competitively displaces opioids from receptors, reversing respiratory depression within minutes. It is now available over the counter in most U.S. states. Widespread naloxone distribution is one of the most cost-effective public health interventions ever studied. The opioid crisis is not a story of moral failure. It is a story of predatory marketing, regulatory failure, undertreated mental health, and inadequate social support systems. And it is far from over. Science offers solutions. Whether society chooses to use them is a different question entirely. Thank you for watching Medical Sciences Unfolded.